Hello and welcome back. My name's Andrew England and I'm the module leader for the Imaging of the Cardiovascular System module. I'd like to give this introductory presentation in order to explain the module and hopefully answer any questions. If not, please do not worry, we'll have plenty of time over the next few weeks for me to explain things further, or you can email me at a.england@salford.ac.uk with any questions. So Year 2 Semester 1 is split up into two modules. We have Imaging of the Cardiovascular System, which I look after, and that's a 20 credit module. And then alongside it we have Advanced Clinical Skills 1, ACS1 for short, and the module leader for this is Joanne Ashworth, and this is a 40 credit module. And Joanne will explain the content and the assessment for the ACS1 module, and I will just talk about imaging of the cardiovascular system today. Perhaps in order to understand the module, it's worth us having a little look at the timetable for the next few weeks. Again, the timetables are in the same format as normal, an Excel file, and that's found in Diagnostic Radiography folder on Blackboard. And if we just take a look at the first week, we can always check when the week is. So this is the week beginning the 6th of October. And it's classed as academic week 2, which is the week you come back at. And we can see Monday right through till Friday, and there's obviously a variety of colours, and I'll explain those in a second. Imaging of the cardiovascular system is the main academic module. The Advanced Clinical Skills module is more of a clinical module. There's only one lot of PBL, and that's for imaging of the cardiovascular system, and that's on a Monday morning. For the first week it'll be between 10 and 12, and then afterwards it will be from 10 till 1, because obviously there's a session for feedback. And again, we've split this up into 5 groups, and obviously you'll need to check your group and the tutor and then look for your room. And please note that these rooms could change week in and week out, so don't just turn up to the same room. The Imaging the Cardiovascular System lectures are there in purple colour, so again it does vary a little bit. Typically we have one 9 till 10 on the Monday, and then we have lectures on the Monday afternoon, and then later in the semester we'll have them on Thursday as well. The clinical skills labs, there's quite a lot to say about these. They're on a Tuesday and a Wednesday, and because we're in year 2 now, there's a few differences. We can do clinical skills in the x-ray rooms, on the CT scanner, and towards the end of the semester we do some skills labs in the ultrasound rooms, which are on the 6th floor near Joanne Coward and Christine Blakely's office, just opposite there. Again, you'll need to look on Blackboard to check your groups and see when you're going to attend. For the first week, clinical skills labs are only on a Tuesday, and that's when we're doing an introduction to the CT scanner and some image appraisal. Now, it is worth saying, you might be thinking about the colours. Why are the colours in blue? This is where there's a slight amount of overlap. For the image of the cardiovascular system, some of the skills labs cover the content that we teach there, but there will be tested in the ACS1 module, so that's why they're coloured blue to match that module. What it's perhaps best saying is that we can test anything that we teach in semester 1 really in the Advanced Clinical Skills module, because that has a written exam. For the imaging of the cardiovascular system module, this is an essay, and I'll explain that to you towards the end of this talk. But again, points to note, please check what skills lab you're in. They're either on a Tuesday or a Wednesday, and please do not attend any skills labs which you're not assigned to. Joanne will explain about the rest of the week, because these cover the ACS1 module. Just a little bit about the Thursday in the first week. This is the article critique day, and this is very important because one of the assessments for the ACS1 focuses around this, and as I've said, Joanne will explain this more on the Wednesday morning session. So just to talk about the image of the cardiovascular system module, why have we run this module? Well, cardiovascular disease is massive. If you think about your practice on clinical placement, there's an awful lot of patients that we see in the hospital which are being assessed for cardiovascular disease. It's the leading cause of death both in the UK and worldwide. If you think about people when they present and they may sadly die due to things like a heart attack or stroke, these are all caused by cardiovascular disease. disease. And if you think about the burden we have on the NHS, in the UK, over 1.6 million men and just over 1 million women are affected by chronic heart disease. So it's a massive burden on NHS resources. And one of the theories behind it, if we can find these people and treat them more efficiently, we can increase the quality of life for these patients, reduce the mortality, but also reduce the cost to the NHS. It is a killer. A large portion of patients do die from cardiovascular disease, so it's obviously worth making sure that patients are treated correctly and are imaged correctly. And again, as I've said previously, one of the biggest things that we see in the hospital is patients which are admitted because they're having a heart attack or a myocardial infarction, which is the more clinically correct term. So heart attack is a big thing that we look at in this module, and the other one is stroke. And the imaging department is required to deliver a very prompt service for patients with suspected stroke. And again, that's something we'll look at. What is the imaging pathway for a patient with suspected or proven stroke within the NHS? So cardiovascular disease, I've said that the main conditions really are surrounding the heart and the brain, so coronary artery disease and stroke. But the cardiovascular system obviously is the main network which supplies blood to various parts of the body, but also drains blood back to the heart. And we can see diseases of the peripheral arteries. So I've put this first picture just to show you about stroke, and that's usually when there's a unilateral weakness, so one side of the body's weaker than the other. So we can see this facial droop on this patient. Peripheral artery disease, so that's really the arms and the legs. Well, the legs tend to get affected more by cardiovascular disease, and we can see, not necessarily a normal foot in this image towards the middle, and we can see one where there's poor blood flow. We can see typical blue toes. We'll also look at other arteries around the body, particularly the aorta. There's lots of conditions that can affect the aorta, particularly the aorta can swell, and we call this an aneurysm. And you may have heard patients that have had an abdominal aortic aneurysm, or maybe even presented with a life-threatening rupture. And the other area that we'll look at is a thing called thromboembolism. That's when you hear about people saying they've had a blood clot and it's moved to a particular part of the body. So we need to think about how we'll image the cardiovascular system. It's probably one of the biggest organ systems where we use pretty much all imaging modalities. So it might start with conventional radiography. So that might be a patient if they've got an ischemic foot. We might be looking for signs of infection, so they'll have a foot X-ray. It might be a patient that's presented with short of breath following heart attack. So we might do a chest X-ray, and particularly because the cardiovascular system is so essential, some patients that present with problems with the cardiovascular system can be very unwell, and it'd be difficult for us to get good quality chest X-rays on these patients. So we've got to think about adapted techniques. So they may be unconscious, they may be in intensive care or in the resuscitation area. We may need to think about imaging these patients with mobile techniques, and we need to think about the differences between imaging a patient in our X-ray departments against imaging a patient on the ward, in theatre, or within the A&E department. We use fluoroscopy, particularly we use a brand of fluoroscopy where we inject contrast agents, so that's either venography or more commonly angiography to look at the arteries around the body. CT plays a massive part in looking at the cardiovascular system, particularly in imaging of suspected stroke, but also when looking at the aorta and the surrounding blood vessels. Ultrasound again is widely used to look at blood vessels, both to look at the heart as a large structure, but also to look at blood vessels around the body. We might need to think about which one would you choose to use first and why. What advantages does ultrasound bring maybe over CT? We're starting to see an awful lot of MRI, so magnetic resonance imaging, being used for the cardiovascular system, particularly to look at the heart, but also to look at blood flow around the body, particularly into the brain. So again, what advantages does this modality bring? And lastly, we use nuclear medicine. So we inject some radioactive isotopes in the body, and they collect in certain parts of the body, and they can give us information about the blood supply to an area, or maybe even the lack of a blood supply to an area. area. So there's a whole raft of imaging modalities which we need to consider using, and we need to maybe justify why we would use them for different conditions. So sometimes we get asked the question about why am I having a CT scan, or why am I having an ultrasound scan, or maybe more academically we ask you to answer the question which is better, which modality is better for imaging stroke, which modality is better for imaging abdominal aortic aneurysms. So which is superior? And again, this is just a sort of a comical example. A Ferrari versus maybe a rusty car. Which one's likely to be better? But I guess we could debate that in terms of better for what. Maybe one's faster, but one's certainly a lot cheaper. Probably ultimately they both do the same thing, which they get people from A to B. And debating imaging modalities is a little bit like that, in that potentially they both will do the job, but again we've got to argue which one has superiority. So just by way of an example for some of the discussions we're going to have over the remainder of this semester, abdominal aortic aneurysms, as I've said, is a swelling of the main blood vessel which runs through the chest and the abdomen. We typically do CT and ultrasound to look at this. So this is a CT image, and we can see this big swollen aorta in the centre of the image, and again on the ultrasound we can see this big black area, which is this big swollen blood vessel within the abdomen. Now we know one uses ionising radiation, a CT scan, one doesn't, so again there's some differences there. CT scanners are very expensive. We can pick up some ultrasound scanners for maybe several tens of thousands of pounds, so there's some differences there. One uses cold jelly, quite operator dependent, and one requires a patient just to lie on a CT table, but does require for most cases an injection of iodine, which does carry some risks which we'll talk about. Other areas, pulmonary embolism, so this is where a clot, usually in either the lower leg veins or the pelvis, moves and gets stuck in the pulmonary arteries, and this is a nuclear medicine scan, so it's called a VQ scan, ventilation perfusion. We see the ventilation side is when the patient breathes in a gas of a radioactive isotope, and usually you would imagine you'd see two lungs, as you can in this case. The perfusion scan is where you get injected with an isotope, and ideally the isotope should be able to get through all the pulmonary arteries to all of the lungs, and we again would expect to see two lung shapes, and we can see this gap on the right lung, and that's because there is a blockage and the isotope can't reach part of the lung, so this indicates a pulmonary embolism. So nuclear medicine has been used for years, but there is a challenge with a CT scan, or more precisely a CT pulmonary angiogram, and we can see the pulmonary artery coming out the heart, this big white structure, and it splits into two, and normally you just see a very, very white bright vessel, but on the left side we can see that this white vessel has got like a streak of black inside, and this is a pulmonary embolism. Now again, both use radiation, so again, why would one be better over the other? And that's something we'll need to consider. How do we assess whether one modality is better than the other? So as a guide, the questions we'll need to start thinking about really are, what are the strengths and weaknesses of each imaging modality? Ask ourselves which modality demonstrates the pathology the best, but how do we define the best? Is it in terms of the pathology it detects, small pathology, large pathology, the speed in which it produces this information, the range of patient types which are accessible, so the very acutely unwell to maybe even children? We need to look at research to answer these questions. So what does the research say? Now research isn't always that easy. It doesn't always say you should always use CT in acute stroke. So we need to think about, how do I interpret the research? Research may have been done in America. Practices are very different within the UK. Can we use their conclusions to inform our practice? So we're going to start to think really about how we assess imaging and how we apply it to our patients based on evidence. And by thinking about the research and about how we interpret research, kind of feeds in hopefully to what you'll be doing in year 3 when you'll be producing your own research through a dissertation. There will be some new concepts to learn, particularly in year 2. We get you to start to think about how imaging fits really in the overall care of the patient. So rather than just thinking somebody hurts the hand, they have an x-ray, but to think about how imaging fits within published guidelines. So for example, there are national stroke strategies, so how a patient should be treated with suspected and proven stroke, and we'll think about how imaging fits in there. Abdominal aortic aneurysms, how does imaging fit in there? So we'll think about how imaging fits really within national guidance, because that's what we'll be expected to adhere to within the clinical department, and really to consider how that, whether that's based on good evidence. Some of the time it's not, it's based on opinion from leading clinicians. A few things to mention before I finish this talk. The imaging of the cardiovascular system modules delivered by PBL. There's 6 scenarios, and rather than getting you to produce your PBL notes as a group with a Word file, we encourage you to use a wiki. And our wiki is basically a web page that we give you through Blackboard, and you can type PBL notes directly into that. You can put links to websites. I think you can embed pictures and even videos. But the advantages of it, everyone will have access to a live set of PBL notes which they can contribute at different times of the week. I will say in a few minutes a little bit more about wikis and PBL, but again, we would encourage you to use this, and your PBL tutor will help you with accessing the wikis. I've said a bit about the skills labs. We're going to do CT, general and ultrasound. I do want to mention that we use some advanced simulators in year 2. Now, what do we mean by advanced simulators? They're a little bit like resuscitation dolls. I've put 2 images. The top image is perhaps the best one to think about it. These are very, very advanced, that these patients can talk, they can move, they can blink their eyes, they can show problems with their airway, we can feel a pulse, and we can show problems with the pulse if the patient's going to have a cardiac arrest. Now, we use these simulators for a scenario in this module to think about patients having an injection of iodinated contrast. Now, I will give more information, a full explanation will be given, but just to think about that we are going to use these advanced simulators, which are, maybe a little bit difficult to get your head around initially because they are very, very lifelike. I do want to mention there's only one element of assessment for this module, and that's an assignment, and it's in the form of an essay where we ask you to compare imaging modalities for a particular condition. Now, I will post on Blackboard an assignment brief. I will give a webcast similar to this to explain the assignment, and there will be plenty of opportunities to discuss that with me over the next few weeks, so you will be fully supported. Just a bit about the wiki, just so you understand. For those of you who don't know, a wiki is basically a website where you can add material, you can remove material if you so wish, and you can edit the content. And the best example of that, which we're all guilty of using, is Wikipedia. Okay, so each week you'll go to your trigger. So if it's this week, you'll go to trigger 1. If you click on trigger 1, and you'll find your group, and there'll be a wiki for it. If you click on that, you'll then be able to add context. You'll be able to type into the website as if it was a Word file. What we can track through this really is the contributions by all members. So if I was to add something, you'll see at the side, AE has added a picture. Okay, so that way we can see that everyone's contributing, but it also means that you're not relying on a set of PBL notes to be emailed around and people have to, sort of collate them at the end of the week. It's a live set of PBL notes which you can use. No other group can access your wiki, so there's not a bit of cutting and pasting. Let's wait for group 2 to finish, and then we can just have their notes. Okay, and in the past, and you may have used this in first year, it's been very, very highly rated that it's a very good way of generating some good quality PBL notes. Oh, so the assessments, I just want to finish really by talking about assessments. Only really concerned from my point of view as module leader with the imaging of the cardiovascular system, and it's a comparative imaging assignment, so it's an essay. I did say more will follow. I'll do a webcast to explain everything, and there will be a published assignment brief. For the ACS 1, just Joanne will explain all of this, but there's an article critique which includes a short reflection. There's an adapted technique OSI, so a written exam, and as I said, Joanne will explain more on both of these points because they fall within her module. From my point of view, assessment support, I will deliver a full assignment brief as a webcast on Blackboard. I will post the assignment brief as a PDF file as well, so you've got the full factual document about what's expected. We do, rather than accept a draft of the assignment, we accept a formative plan. So you write a plan of what you're going to do in your assignment, and either myself or Andrew Tootle, which is the other marker for this module, will give you feedback. All submissions, whether it's a plan or whether it's the full assignment, are submitted via Blackboard. If you do submit a plan and it is optional, we will give you feedback on the plan, and then the final submission of the essay is the 2nd of December 2014 by 4 o'clock, and again there's a folder on Blackboard for you to do this, and we use Turnitin obviously to assess every submission. General feedback from last year, it was the first time we did this type of assignment last year. It was very, very good. Certainly in terms of marks, there was very few students which struggled. I think there was only 2 students which had a fail. So again, if you put the work in, there's no reason. If there's anything that I've not explained, anything you want to ask me, I teach a lot of the content for this module, so there'll be plenty of time at the end of class or at the beginning to ask questions. If not, come see me in my office, or you can email me a.england@salford.ac.uk, and I look forward to seeing you all next week. Thank you.